Today kicks off National Child Protection Week, and this year the theme is Putting Children First. The country's children have suffered immensely, from abandonment and abuse to losing their parents and other loved ones to COVID-19. So how can we ensure that children are put first? To help me answer those questions, Dr. Shahida Omar from the Teddy Bear Foundation is here. Thank you for joining me. How do we compare with other developing nations when it comes to nurturing and protecting our children? Dr. Shahida Omar?
So thank you for asking that question. Sitting on so many global platforms and listening to other mental health professionals, social workers, psychologists across the globe, I think whilst the music changes, the lyrics remain the same. So children are faced with the same challenges, with the same insecurities, the same confusion, and of course, I think has escalated to a level of high anxieties, where children are suffering from post-traumatic stress disorders, depression, and we've even found children who have been in situations where they've committed suicide or attempted suicide. So the landscape in South Africa is not very different from the rest of the world.
So what are we able to do about it? Are we investing enough? Do we have enough resources dedicated to trying to help our children out of these sorts of situations that you've just described?
You've asked a very critical question. I think COVID-19 hit us all totally unprepared, off guard, and it was unprecedented. And of course, we were faced, with not knowing what to do, how to manage the crisis, how to manage children, how to address their fears and anxieties, and even fears of abandonment and fears of loss, and of course a lot of grieving, where children were surrounded by death and dying. So working with government and with civil society organizations from last year, March, to where we're currently at, a lot of things have been done. A lot of progress has been made, where resources are more available and accessible to children, to families, to learners at schools. The psychological support units with the Gauteng Department of Education and other provinces have come to the rescue to reach out for children. There are rapid response teams, and referral pathways have been created, because at the time of the total lockdown, many children were trapped, immobilized, and as a result, some of them, I would say, a large percentage suffered not only emotional abuse, anxiety, but some of them were subjected to physical abuse and even sexual abuse. So they were trapped in a place where they were supposed to be safe and secure, where home is supposed to be the place of hope. Unfortunately, that was not the case. But going back now, there are protocols in place to address any pandemic in the future. I cannot say we are 100% on track, but we have certainly made huge progress where there's intersectoral collaboration between law enforcement, social development, civil society organizations, community-based organizations, and faith-based organizations.
But is there enough getting out in terms of the marketing of this message, so that children anywhere in the country, whether you live in the cities or whether you live in our rural areas, are all aware that there is some help available to them? Is that message getting out?
Maybe not enough. I think greater awareness raising on different platforms, whether it's social media, on national TV, community radio stations, going out into the communities and dialoguing with communities in the rural communities on the ground. I don't think enough of that has been done. A lot more has been done, but not sufficient. So a lot more needs to be done, where we need to reach out to the hardest to reach communities where they do not have access to your daily platforms of TV, radio, etc. And I think we know that limited resources exist in the rural areas, even in terms of helplines and interventions, therapy, that basically non-governmental organizations also being made available, because people have to commute distances if they need to access any kind of emergency response or support.
Dr. Omar, just for the sake of our parents and children watching, can you take me through a protocol? If a child is feeling under duress or stress, They call a number. Tell me what happens so that we can give some confidence to people that are watching.
Well, thank you for asking that. I think it's important that if a child is in distress, or if a child just feels a sense of discomfort or dis-ease, they're just not feeling okay, they have every right, and the important thing to understand that there's a national toll-free number, the Childline number. The number as it exists is 08000 55 555. Now this is a toll-free number, and the number is being changed to 116. But it's a toll-free number for parents and children to call, and that call would be received immediately, and they would certainly put the child into contact with any resource that is required, or they would act on behalf of the child, bringing in the support of law enforcement, social development if the child is above the age of 12 years, any child welfare society if the child is below 12 years. And if it's a case of gender-based violence or domestic violence, because usually there's a co-occurrence of domestic violence and child abuse. So in cases like that, Childline could also act on behalf of the person calling in, whether it's an adult or a child, and contact the domestic helpline, which is 0800 428 428, to ensure that immediate support is actually made available. So that would be the immediate response. And I think that is something that parents need to understand, and even children, because the work that is being done at schools or even in your grade R school facilities, children are actually taught the crisis line, that should they require any kind of support, that is the number to contact.
Thank you very much for your time this afternoon. Dr. Shahida Omar from the Teddy Bear Foundation.